Hello, everyone out there, and welcome to Baby Communication Week. My name is Anulika, and I'm the director at the Brazelton Centre UK. We've had a really exciting week so far, where we've been talking to a lot of different professionals, and we have also been talking to a parent about how important it is to understand babies' communication and how we support parents in understanding that too. So today we're going to be talking to Anulika from Manchester, and she is going to be talking to us about how they have implemented the NBO Manchester. So I hope that Anulika is able to join us. Just right there you are. Hello, Anulika.
Hi, Inge.
Hello and welcome. So great.
Thank you very much.
Thank you. And it's so great to see you. Haven't seen you for ages. So nice to see you in person as well. So, well, not in person, but live in person. That's great. So today's talk has been called Speaking Babies' Language Across Manchester. So just wonder if you'd be able to introduce yourself, and then we can have a think about what you've done. But before you do that, I just want to say to anybody who's listening, please, if you do have any questions for either myself or Anulika, then please put them in the comment box, and then we'll try and take those at the end. Okay, so Anulika, please do introduce yourself.
Hello, my name is Anulika. I'm a specialist health visitor and lead for perinatal and infant mental health within Manchester Health Visiting Service.
That's great, thank you. And you're also one of our lovely trainers for the Brazelton Centre.
Yes, I'm also a Brazelton trainer.
Yeah, absolutely. So the first thing we sort of wondered about is how you came about actually getting all health visitors trained in NBO, and how that kind of is embedded, the baby communication is embedded into the care that you give across Manchester.
Yeah, I think the thought of having everybody trained in the use of NBO came about with the big drive on the 1001 Critical Days manifesto, when we started thinking seriously about infant mental health, what it is, and how, as practitioners, we could embed some resources within our practice to support parents in supporting the mental health and emotional well-being of the children, getting those brains to form as early as possible in the correct way. And in Manchester, initially, there was a big drive from the Thames side, led by Pauline Lee. She started the drive to train the health visitors, the nursery nurses, and started the early attachment service in Thames side. And in Manchester Health Visiting Service, we initially decided to look at what will benefit our families and how can that work. We did an initial training on MBAS to train some health visitors to do MBAS. So we came around the other way to do an MBAS training first. But then we now thought MBO is about relationship, and it's not an assessment. We need to begin to think about supporting parents to build that relationship as early as possible. We went to our commissioners and, of course, put the case forward. Our commissioners and Manchester Health Visiting Service, the management's been absolutely fabulous. So we got the funding to train all the health visitors. And the next thing was the drive of how do we do it? And within the practice, it was at around the time when I came in post as a specialist health visitor and the lead for perinatal and infant mental health. And we decided to look at the change management from who do we train first? How do we support each team? Because it's going to be a change that is very easy, but we need to go about it the right way.
Yeah, absolutely. So when did this all start, Anulika?
It started in 2017. Our first initial training for EMBO was in October 2017 when we trained 20 health visitors. And between then, we have now trained 191 health visitors. And in the midst of those 191, we've trained about 3 people from the infant feeding team. That's the infant feeding team support workers. There were about a few of them that also have the training. Not that they go out delivering EMBO, but they use it within their practice in supporting parents during that process of infant feeding challenges. Yeah. Yeah, we did 191 training all together till now. And then we have a rolling program. So we want to make sure in Manchester that it's not just like a one-off. It has to be a continuous thing because it needs to be equitable. We need to deliver it to every family. And so we have a rolling program that when the student health visitors are qualifying to become health visitors, and we have some people coming into the trust, we have to deliver an EMBO training to get everybody on board.
That is absolutely amazing. So how, anybody who's listening as a health visitor or manager or anything like that, is there a particular time that the MBO is carried out with parents, or is it expected that it's used in most contexts? I mean, I know that the language in your proofs, once you've been EMBO trained, you cannot take that away from somebody. So it changes your approach, it changes your language. But the whole kind of observation, is there any expectation that the health visitors carry that out at any particular time?
Yes, we built the MBO, delivery of MBO as a universal service for all the babies born in Manchester within the first 3 months of life. And we felt that the best way is to build it within the core contacts that we do, which is the new birth visit or the 6 to 8 weeks visit. A lot of the aspect of MBO is actually what we do as health visitors, but rethinking the way we deliver it in such a way that we step away from just going to talk to parents and just talk and talk and then and maybe give some leaflets, and then as you're walking out of the house you can see a toddler eating that leaflet and you're wondering, this mom that's just had a baby, how much did she manage to take in from all the things that we talked? Within our new birth visit, we will look at feeding, we'll look at sleep, we'll look at safe sleep, we will look at crying. There are core things. We'll look at the baby attunement, relationship. And so we built the MBO just like a tree. Okay, so it's like a tree that you hang in things. So instead of just having an MBO sitting away, it is built within. At that time when you're going to pick up that baby and look at that baby is a time that we will do the MBO alongside. The time we're talking about feeding, we're talking within the context of MBO. So parents can actually see, not be told. It's not like I am telling you this, and it steps us away from just going to advise people and then come out and then mom says to you, I've done that, done that, done that. It's not work. To helping them find the solution. I mean, what is MBO? For me, I just look at MBO as a parent saying, who is my baby? Could you help me find who my baby is? There is no pass or fail. It is each baby and parents being able to understand the language. The behavior of every child speaks volume. While they don't have words that they say, they have a lot that they say from their behavior. And within our new birth visit, we built the MBO. And if within the new birth visit, like sometimes you go for a new birth visit and something else just come up, and maybe there's something really paramount in mom and you spent a lot of time dealing with that or with a baby, then when you go out to do the 6 to 8 weeks visit, you will have that opportunity. And it sits nicely with the 6 to 8 weeks visit, because that's when we do the baby developmental review, the 6 to 8 weeks developmental review. And a lot of the components of MBO is found in that developmental review, the social, the communication, the personal, a lot of those content is found in it. So that it's still within like a tree where you hang so many things. And you rightly said, Inge, we use it to deliver therapeutic baby massage. So looking at attunement, looking at autonomic responses, knowing when to touch the baby, what the baby is saying, and what to do, and what time to do it. We use it in the clinic, but the core is within the new birth visit and the 6 to 8 weeks visit.
That's really good, and it's so powerful. And what you're really, really highlighting is that kind of how you look at the baby together with the parents, and you listen to the baby, so you can start understanding how they communicate. And I think it's so important, because we all know that every single baby is an individual.
Yeah.
So it's so important that we look at that baby together with the parents, and that's just great. And the way that you integrate that into all the other services, I really like that. So of course you can use it with baby massage and anything else that you do, because watching that baby and how they communicate and how they say, yeah, I like what you're doing, or actually hang on a minute, I just need a break, or actually today I don't want to do this. So that's so important. So that's great. We need to have the Manchester model across the UK, across the world.
We'll be happy to share.
Yeah. So you're kind of sort of, I mean, your passion and inspiration is just kind of shining through here. But what inspired you to go big like this and have all staff trained? I know you mentioned 1,001 critical days, but it takes passion to come through with something like this.
Apart from the passion, we want to do what is best for our families. We want to do what is the best, and it saves time for the long run. It saves a lot of time. Those parents that would have been calling and calling and calling, trying to find out, you've kind of empowered, supported them to find out very, very early. We went big because we didn't want to leave anybody behind. We didn't want to leave any family behind. It wasn't like train one person there and somebody gets it. I believe that the universal service provision should be where the core should sit. And apart from the universal service provision being very solid and evidence-based, that is effective, that is efficient, it will save a lot of pressure on the higher level, those ones that are managing with additional needs. If we've done the universal service properly, it will save a lot of money, it will save a lot of time, it will relieve pressure on the higher end. So like Manchester has a population of 38,000 babies born 38,000 babies, and we have about 78,000 babies born every year. 38,000 babies and 78,000 families, a total population of about 552,000. So if we trained maybe 1, 2, 3, or maybe 10, 20, or maybe we did one training and we didn't continue, the question will be who gets it and who doesn't get it. It takes us back to that postcode lottery thing, which we didn't think it was the right way to go about it. And so we had to do it in the right way. We have to carry out 1,001 critical days manifesto. We have to look at our start well policy. We have to look at the school readiness. We're looking at that communication, babies, children going into school, ready for school. So we have to do it in a way that it's equitable across the board.
Yeah, absolutely. And I do agree, universal is definitely key. Have you noticed, or do the health visitors who are trained, what do they say about it? Have they shared any benefits of it?
Yes, yes, the Elvises have shared a lot of benefit. One of the benefit is the confidence, the boost of their confidence. Okay. And that is something so good when a practitioner is going in, having that cap that says, I know what to do. Okay. I understand what to do. And within the context of what is happening in that home, I can pull from so many hearts to be able to manage and to be able to give the parents what is best for them and for their babies. So a lot of the benefits include practitioners building relationship with parents very quickly and very easily. When and sometimes that you go and do an MBO, do a visit and do an MBO, and you're walking out of the house, mom and dad is saying to you, thank you so much for coming. Really, really grateful that you came. Or you finish an MBO and you see the mom hold their baby and maybe start practicing some of the things you did. And you're looking at you, you just have that feeling like you've just given me something here. It didn't take a lot of time, but you've done it. So practitioners' confidence is boosted. The relationship between them and the parents is boosted. Practitioners can go to meetings and talk about the baby's language. They can talk about the voice of the child. We can quickly get the voice of the child for children in schools when we ask them, but what of the babies that don't have those spoken voices and words to speak out? We can quickly get the voice of the child within the universal provision for families with additional needs and for families when things are critical. We will be able to bring that across. So practitioners feel that it saves a lot of time for them. I do remember when I first started, and you just think about that family that you've gone in and you've done your assessment and you just feel, right, this might require a lot of work. And you've gone out and done an EMBO and you just go back out and you just see things working so well. Not because you're there telling somebody do this or try that, but because they've been able to understand who their baby is. And knowing who their baby is and what the baby is saying and meeting those needs. I mean, it's just amazing. Parents feel confident to ask you and you feel confident to respond, because whatever happens, we just say, let's go back to the baby. Whatever the question is, let's go back to the baby. What is the baby saying? And then we can just work from that.
Yeah, no, it's so powerful, the kind of, let's have a look at your baby and actually learn from the baby what it is that the parents want to know. It is so powerful. And I like the fact that, yes, the baby does have a voice right from birth. But you do almost need a tool or an approach like the EMBO or the MBAS to kind of use that as a evidence-based tool, I guess, to really be able to do those kind of reports as well. But so powerful. So thinking about the parents and the families, have you got any kind of experience of working with parents? And can you tell us how they kind of experience it or how it was for you? I mean, you said a little bit about what it's like to go in, and it is very powerful to be able to learn together with the parents rather than being the teacher. It's so powerful, and it's kind of that validation as well, isn't it, Anulika? That kind of parents do look at their babies and they know so much about them, but maybe they don't know what they don't know, but they do know so much, and that feels so empowering when you can kind of get them to feel that sense of confidence. So any kind of experiences that you can think of?
Yeah, I've got quite a lot of experience. I'm just going to pull from few. The big thing about the EMBO or the MBO is being able to help parents to find their baby early and to have meaning for things. It's where a smile could be brushed away as wind. That smile is brought into the real sense of it, and it's a sense of pleasure. Okay, we are positioning could just be, oh wow, it's just having a stretch. to the baby is telling me things. I'm just going to pull from three. There was, and one of the things about EMBO is there is no pass or fail, and it fits well with every child. I went out to see a family, a baby born with Down syndrome. And you know, when you're thinking about Down syndrome, a lot of times we're thinking about the pathology, what's not working well. And we went to see who the baby is. And I remember on that occasion, Mom was just like, you know, he's got Down syndrome. I said, yes, I know. But let's look at it. Let's see what he's trying to tell us. And this baby, it was, and I started with embryo, but I ended up doing a full embrace because the baby was robust. He was asking for more. He was bringing out a lot more. And this baby, the social aspect of the embryo was so fantastic. He was following, he was looking, he was engaging. The reflexes, apart from the muscle tone, which we knew, but then I didn't navigate towards the muscle tone because I already know that. So I went for, let's look at this baby. By the time I finished, Mom was like, wow. And Mom said to me, he's perfect. One of the things I want to say about parenting is, I don't know how many parents are watching us. I'm certainly one of them. Parenting is not an easy job. Parenting is not an easy job at all. And to now think about parenting and where you're parenting, and there are some difficulties associated with it. Maybe baby was born premature, and you have to deal with that aspect of things not going the way you expected it. And then for somebody to help you to look to the baby and see what is working. Is that when we know the baby is coming to a relationship with a lot to give, then it's easier for us to manage it. A relationship that was one-sided can be a little bit difficult in any relationship. But when we know that our baby is giving something, it's brought something, and we're drawing from it, it gives us strength to now move to the other areas, to look at the other things, maybe some of the things that is not working so well, some of the things that will still work well. So it's about who this baby is. I remember when I went to see a mom, the mom baby was born within the lockdown, was in special care baby unit, was born premature. There were a lot of difficulties associated with staying in the special care baby unit. And I remember Mom looking at me initially when I came, and she was saying that she was blaming herself because she couldn't carry this baby to term. And she was worried about the baby not meeting the milestone. The key thing in her head is that milestone and being a failure. So we went through it and said, let's look at your baby. As fascinated as things worked out, Mom was holding the baby, and the baby started making some sound. And she started responding. And I said to Mom, do you mind taking your head to one side and keep talking to the baby? So she did this social item. And by the time she finished, I was just talking with her in between and she just said to me, this baby communicates so well without me saying anything. And she said, I suppose I've spent so much time thinking about what's not working well. I've missed out on how much he's saying to me. And this baby's communication in there, it was so clear. He says when he wants something, when he doesn't want it, when he needs a break. The responses were so clear. And Mom seeing that, it was just amazing. It was near the time for this baby to have the 6 to 8 weeks developmental review, but I could see that Mom going to that developmental review, not worried about meeting milestone, but happy for the baby that she's got and who he is. As I was about to leave, she looked at me and she said to me, what was that you did? She wanted the name. I think maybe she's going to go and Google it. I think she's going to go and do a bit of a Google. I told her it's a newborn and just finished about newborn observation, newborn assessment scale. And she just said, thank you so much. Thank you for coming. I've got so many evidences. There's one, and she just ran to the health visitor and said to the health visitor, "Thank you so much for getting Anulika into my house." And the health visitors in Manchester have these stories across. It's not just me. They have the stories of going from parents not knowing to knowing. And we're not coming in as the expert. We know what to do. We know what to tell you. We're coming in to validate a lot that parents already know and support them to know a lot more.
Yeah, I mean, it's amazing, and it's so, again, evident that we can't promote that parent-baby relationship. And then I also get a very, very strong feeling that it helps you build a very strong relationship with those families. And if they ever were concerned, they'd come to you. They'd want to talk to you because you kind of got that trust. So just one last question, Anulika, and that is for anyone, managers, commissioners, anyone, how would you encourage them to go about kind of doing what you're doing, implementing something incredibly important as a universal tool, ensuring that all families have access to this experience, and ensuring that all healthcare professionals feel confident and understanding babies' communication as well?
I would say, please do it. And I'll give you the model that we've used in Manchester that I've led, which has worked so well. And I would say, train everyone. No one should be left behind. No families should be left out. And I would say, look at it as a universal provision. And look at it as something that embeds within what you're already doing, not something that sits away. I know how stretched the health visiting service or a lot of services across the board is. And I know that a lot of people are worried, is it something else that you want me to do? Is that another thing? And I'll say it's not another thing, because when you do it, but the health visitors that have worked for many years, the health visitors have worked for many years in Manchester, you know, the ones that started working in the 70s, in the 80s, they enjoy using MBO within their practice. And the newly qualified, the young ones, very enthusiastic, they all enjoy it. I would say the model I've used in Manchester is begin the training with the most enthusiastic. This is what we have done. So when we advertise for the first training, you will have those people that will say, I want to come. Often the ones that say, I want to come, are often the ones that already are keen, they're really interested, they want to go with it.
Yeah.
Another thing we did is to pick up those that are coming initially from each team. So you don't have like one team trained and the other ones. Because when they start looking at the competency and the certification and embedding into practice, those ones will be the support to support the ones that are training later on, because they can observe, they can shadow the ones who are already delivering EMBO. The next thing is, I would say, aim for each team to have one person review your documentation. So one of the things we've done in Manchester is to review our new birth visit documentation. So instead of saying, ask question about attunement, everything is built within EMBO. By the time we started EMBO, we were using paper documentation. And 2018, January, we moved into digital documentation using IMIS. We have to build the whole template. And building the whole template means we have to build EMBO within the practice. Look at the documentation so that it's built within. It's not separate. It's not when you've done the new birth visit, then you now go and complete EMBO. It needs to be built within. Or when you have done your visit, go and do EMBO. No, it needs to be built within. Okay. Build into practice. Look at the model as a tree where you hang things. Look at it as something that every parent wants to talk about: sleep, about feeding, about crying. Let's show and not just tell. It's better for them to see. And then the other model that we've continued with is to have a process of training those who are joining later on in Manchester. So we deliver the embryo training between November, December, because often in January, the health visitors qualify between November, December, and January, depending on when they start their training. So as soon as they qualify, you've got more people coming in to join in the trust and to work in the trust. We quickly do the training. And we have a collaboration across Greater Manchester that works so well. So Manchester is bordered by Stockport, Tameside, Oldham, is bordered by Salford, you have Trafford, and then you have Bury on the other side. So we have quite a big geographical area that we cover, and Greater Manchester is very big. So if I have an embryo training that I'm running in November, like I have one that is coming up in January next year, and I've filled the space with the health visitors that are not trained, I'll put it across to GM and I'll just send it out. And then the others that have some staff that they need to train will just buy into the training. They will just pay for their training and come on board. So it's like a Greater Manchester thing. It's not like, I'm just one dot here doing it all. It helps to work across the board as well when it comes to fewer people being trained.
Yeah, no, it's...
And the other thing is the Brazelton Centre is always there. If you ever need support around embedding it, I know I've shared a lot of what I've done in Manchester, what we've done in Manchester with the Brazelton Centre. It's been shared across with other people that have started their training. If you ever need some support, that's fine. We've carried on doing some refresher, like workshop. We'll all come together and then we'll look at it again so that it doesn't slip away. And we'll look at case studies across the board.
That's great. And for anybody who is listening and interested in this kind of Manchester model, then do contact us at the Brazelton Centre, and we'll be happy to put you in touch with Anulika or share the model with you, because it is great. And there's no reason to go and recreate something, because we know that it really, really works. I just got to see if there's any questions, Anulika. Okay, so there's one question from Mothership. Have you seen any long-term benefits for toddlers and children who've had an NBO? What do you think?
A toddler who's had an NBO.
Yeah, so any long-term benefits?
Oh, yes. Oh yes. I have seen a lot of the babies. Like, we started the MBO training in 2017, and a lot of the MBOs that we've done is 2017, 2018, 2019, and those babies are toddlers now, and those babies, a lot of them are going into like a nursery school. Yes, we have seen them, and one of the things I would say is, for some of those families that we might have anticipated a lot of challenges, we haven't had as much, because we were able to support them to get things quicker, easier, and earlier with the babies. Developmentally, we're seeing babies going into school with increased language, increased communication and social skills. I know we've had a big hit with the lockdown. I couldn't finish this without talking about the lockdown, because it was something that set a lot of people back, and we couldn't get to see a lot of people for some time. A lot of things we done video, but we had to tweak the way we work so that within the video, you can also find a question, support parents to identify things as early as possible. Yes, I've seen a lot of toddlers, and doing well.
Yeah. So there's a question again, so very similar. So if they had an NBO as a baby, did it help them long term? And I'm not sure whether there is any research on sort of any longitudinal studies at the moment using the NBO. I'm not sure whether you're aware of any. But I guess you already started the introduction of this kind of chat talking about the importance of the brain development.
Yeah.
So I don't know. I mean, we can assume what happens to the baby who's understood, have got parents who can understand them, and long term what that means for them. I don't know whether you would be able to say something quickly about that.
Yeah, I think, Inge, while we don't have a longitudinal studies done with MBO, we have a lot of studies done with MBAS. And we know that MBAS is 52 items and EMBO is about 18 items, and we're looking at those things that are relationship building. Within the MBAS, there's been a lot of studies that talks about building relationship, the baby brain, interaction, and the progress the children have made. The work done by Professor Brazelton and Kevin Nugent, it's long-standing for many, many, many years. And there's a lot of studies that supports the effect and the benefit of using the Brazelton model. The MBO is a Brazelton model.
Yeah, thank you. Just got to check whether there's any more questions. So there is another question, Anulika. Do you think embedded into other services, for example, so I guess something about, is the question something about whether it would work if we embedded into other services, such as maternity? And we certainly know that it is embedded into maternity services, perinatal mental health services, mother and baby units, and Manchester is one of the leading places where MBO is used as a universal service, but it's also used across Wales. All Flying Start health visitors there are trained in MBO and MBAS, and we've got many other parts of the UK where it is used. Yeah, lots of different places. So, but I don't know if you are aware of maternity services. Is that something that you have?
Yes, mainly in Thameside, because the Thameside started the lead on infant mental health and developing infant mental health. The midwives in the maternity unit, some of them are trained, especially the midwives that are leading perinatal mental health. A lot of them are EMBO trained. In Manchester, I know some of the midwives that are leading perinatal mental health are EMBO trained. And it would really be nice to have the MBO training embedded within the midwifery service. When a baby is born, before the baby is discharged from the hospital, one of the things we do is the newborn examination, which is quite medical. We're looking for anomalies. Okay, it would really be nice while we're doing that we also embed the MBO into it and support parents to look at who their baby is. So they don't just go out thinking my baby failed that, my baby failed that. I don't think something is wrong. I think something is wrong with my baby. We can look at what is going well as well. In Manchester, the Home Start coordinators for the parent infant mental health service, the Home Start coordinators are EMBO trained, and we have staff within the IAP service that are also EMBO trained and using the tools within the practice.
Yeah. I mean, yeah, absolutely great that there are so many people using it. And there aren't any more questions. And it's just been great chatting to you and hearing about all that wonderful work that you're doing up in Manchester and everybody that you work with. It's so fab to hear. And just to let anybody know who's listening, tomorrow we're talking to Nadia Reisland, Professor Nadia Reisland, who's based up in Durham, and she'll be talking about babies in utero and how they communicate. And then on Sunday, on Father's Day, I'll be having a chat with some of the coordinators from Dad's Matter, who is also based up in Manchester, and we've got Gloucestershire as well. So do join us for any of our other talks. And if you haven't managed to see them live, you can go back and watch them, and they'll also be available on YouTube. Any other questions that you think about, do email us at the Brazelton Centre, and we'd love to hear from you. Thank you so much, Anulika, for joining us today.
Thank you. Thank you.
Okay, take care and see you soon. Yeah.
See you. Bye. Bye, everyone.
Bye-bye, everyone. And thank you for listening.